So welcome everybody. It's a couple of minutes before 1. So we've got obviously a number of people in the room, but also a lot of people joining on Zoom. So we will just give them the next couple of minutes to make sure everybody can join the Zoom room. As I was just saying to the people in the room, do feel free if you're squished up the back or on the side there to come and sit on these seats where there's lots of leg room, and we can throw questions to you much more easily. But if that's not going to work, then then I will open the session and start by thanking everybody for being here, both in person and on the Zoom room. So I'd like to start by acknowledging the traditional owners of the lands that we're working on, both here in person and everybody who's streaming us online, and pay my respects to Aboriginal and Torres Strait Islanders, their elders, past, present and emerging, and any Aboriginal and Torres Strait Islanders who are with us today, and to really acknowledge the custodianship of the lands on which we're working, and these lands were never ceded. I'd like to open today's session with a big thank you to Victoria Hobbs, who's the coordinator of the Nourish Network, and Sian Norton, who, as well as being a healthy food retailer researcher, helps me coordinate the RE-FRESH CRE, and welcome everyone in the room and on the Zoom to a session which really is close to my heart. It's about how we can think about working in partnership across academia, industry, retail, government and community to ensure that we can achieve the public health and population health outcomes that we want, and in this case, drive healthy food retail. So I did want to start just with a little bit of information about RE-FRESH and the Nourish Network for those of you who are not aware what they are. So RE-FRESH is a National Health and Medical Research Centre of Research Excellence, which has been going for 4 years now, and harnesses academics and their government, retailer and community partners from Australia and beyond, as you'll hear soon from Cliona, who's one of the investigators on that grant, really to look at how we might drive healthy food retail and build the research evidence to do that. The Nourish Network has born out of the work we've done through RE-FRESH at a Victorian local level and is now growing nationally. And the Nourish Network is really a way of harnessing the research practitioner retailer nexus and capacity building across those 3 areas and bringing them all together in order to co-design and co-identify solutions and then test and implement them together. So a real research practice type nexus. And so from all the work that we've done across RE-FRESH and all of you who are doing similar research outside RE-FRESH, we really wanted to use today to draw together some learnings that we have experienced around working in partnership. And so the sort of tagline for today was exploring the value of working in partnership to drive meaningful change in healthy food retail. So it's a great pleasure to have 4 panellists who really exemplify the sort of work that we all want to aspire to, and really can share with us, I think, both examples and learnings of all the things that all the ingredients we might need for successful partnerships to enact policy and practice change to have the impact with the communities that we serve. So I'm just going to do a quick pause for a housekeeping check in case I've missed anything important. Great, thank you. So just a reminder to the people who are streaming us, you're welcome to put questions in the chat at any time, and we'll have some introductions and initial discussion from the panel, and then we'll be open to questions from the floor and from the chat. So do start putting your questions in whenever they come to you. So I'd really like to start by first welcoming Fiona Watson. So Fiona Watson, who most of you will already know, is from the nutrition team from UNICEF East Asia and Pacific Regional Office in Bangkok. And for many of you who were in the room just an hour and a half ago, Adrian Cameron gave a really great overview of a number of the partnerships that we've got with UNICEF. And so Fiona is really well placed to come and speak to us both about her experiences in general, but also particularly in the work that she's been doing with that team. She's an international nutritionist with 30 years of professional experience, has worked both in the development and emergency contexts throughout the world. I won't go through her long list of field work because she's told me, no, cut those. But I think it's really important to note that from 2011 to 2015, she was a policy advisor to the Scaling Up Nutrition Movement in Geneva. and currently she works, as I said, in the UNICEF East Asia and Pacific Regional Office. Her focus is on prevention of overweight and obesity among children and the nutrition of school-aged children across the region. And a core part of her role involves working with academic colleagues on innovative research to build a sound evidence base that can be translated into policy action. So I'd like to warmly welcome you today, Fiona, and love to invite you to just say a few words of your reflections of your experience working in partnership.
Thank you very much, Anna. It's a great pleasure to be here. So thank you for inviting me. I actually wanted to talk about a specific project, which is a 3-year project that UNICEF is doing to try to improve the healthiness of the retail food environment in... Oh, sorry, is it on? Is it on now? Shall I start again? No. Okay, so a 3-year project aiming to improve the healthiness of the retail food environment in East Asia region. So one of the several objectives in this project is actually to foster effective partnerships. And there are multiple countries involved across the region. We actually deal with 14 countries, of which, across East Asia. But the particular focus is on 4 countries: Indonesia, Thailand, Philippines, and Chengdu City. And as you can imagine, Chengdu City in China. As you can imagine, those countries are very different. They're very different in their retail settings. They're very different in the degree of the sort of nutrition transition. And they're very different in how retail is owned and run. So in some countries, there are just very few companies who have the absolute majority market share. So given the sort of multiplicity of the area that we're covering, there was a need to have multiple partners involved. So UNICEF works with Deakin, Adrian and Talani. They are our academic partners and actually helping to develop particularly the evidence base for this project. But we also need to work with in-country partners, because we need people who speak the language of those countries. Okay. In-country partners who speak the language, can access information and can collect data. So for each of those 4 focus countries, we have in-country institutions working with us. But also in each country, we're working with our UNICEF country colleagues, not only in the nutrition teams, but also with the partnership teams. These are people who are fundraising. So also with our partnership teams, who are the people who are raising money for UNICEF and who have quite close contacts with different companies. So I was going to talk a little bit about, what has been our most challenging area. Although these are the partners we work with, we need to engage with retailers to actually ensure that this project is going to be successful. And that's where we found our most challenging areas. But perhaps I'll stop there, Anna, and talk about that a bit later.
Thank you. I was waiting for the answers right there. No, that's fantastic. Thanks very much. The next panellist I'd like to introduce you to and warmly welcome is Dr. Megan Ferguson, immediately to my left. Megan is a senior lecturer in public health nutrition at the School of Public Health in the University of Queensland, and she has honorary positions with Monash University and the Menzies School of Health Research. Her research focuses on approaches to support local decision makers to design effective policy to improve nutrition and food security outcomes through incorporating evidence and understanding of the policy context. Her research in remote Aboriginal and Torres Strait Islander communities and community retail settings follows a public health and nutrition career working in policy and service provision in government, remote retail and international development sectors. So welcome you, Megan. I'd love to hear your experiences.
Let's see if this one works. Thanks, Anna, and thanks, for the invitation to participate today. I think for me, one of the things that's really important in terms of partnership is really understanding where Aboriginal and Torres Strait Islander communities have come from. particularly in terms of research, but also in service provision. I've come from policy and practice into academia. And for me, what was really important in working in policy and practice was also working in partnership. And so that means that that's easily translatable into the research that I do. And I think the key thing for me is that no decisions are made without community. And that's how I've learned to work in that genuine partnership approach. And to be honest, if we didn't work in that way, we wouldn't be able to continue to do the work. And when I talk about this, I'm talking about a larger team that works in this environment that I'm a part of. And I think that one of the things that is really that stands out to me is what I've learnt from working in Aboriginal and Torres Strait Islander communities, particularly in remote Australia, has been transferable to a lot of other settings. So I've worked in other contexts and I've operated in the same way that I've done here. And that's worked well for me there. So I've learned a lot and been open to listening to communities in taking that forward. I think one of the other things that you were interested in was the challenges. And so to have that genuine partnership and to have all major decisions made together obviously requires a lot of time. And so time of community, and no matter how much they might prioritise a particular question that you're investigating together, they still have other priorities that come up as well. And also for us in research, the time to invest in that, given the deadlines and so forth that we have, is an issue. So in terms of addressing that, I think I've become much better at articulating the need for that time. So in terms of project timelines, in terms of grants, really articulating why that is important and being bold about that, like saying we can't shortcut that. Having alternate plans in place. So while you might think, okay, every decision has to pass a particular community advisory group, knowing when it's okay that it doesn't have to go through that whole group, and having those sort of alternate plans set up at the beginning, I think is really important. So they're just some of the things to get around those challenges of time in that decision making.
Thanks, Megan. And I'm sure we'll be able to pick up, maybe pop it down that end. Thank you. During the discussion, I think that point is a really good one to think about. How can we make sure that we nurture partnerships, and what does that look like, and what do we need to build to ensure we can do that? The third person I would like to welcome is Amy Brown. Amy Brown is currently the Manager of Strategic Programs at the Institute for Health Transformation, where we work at Deakin University, which reminds me I didn't introduce myself, so I'll do that in a minute. And so with our institute, she's helping us to build, evolve and strengthen partnerships with key stakeholders across a range of sectors. And previously, Amy was based in local government as an Executive Officer of Healthy Greater Bendigo, which was a community movement for better health, working to influence systems, structures and environments to make it easier for Central Victorians to eat well and move more. So you can see she's uniquely qualified for her role on the panel. She's also worked with us, particularly Adrian Cameron, in a research context with a number of research partnerships and trials, including the Eat Well at IGA project, which we might talk a bit more about. She recently helped establish with Adrian the Australian Healthy Supermarkets Community of Practice, which we might also talk a bit more about, which supports health promotion practitioners to work in partnership with supermarket retailers to enable healthier shopping environments. So I will throw to you, but I was remiss. So I'm Anna Peeters. Apologies for not introducing myself at the beginning. I got very excited. I'm a public health researcher who's spent a lot of time thinking about how we build the evidence to transform food retail environments to be healthier. And I work at Deakin University as the Director of the Institute for Health Transformation, and I'm also the lead Chief Investigator on RE-FRESH and Director of the Nourish Network. So many, many, hopefully positive vested interests in this panel. Over to you, Amy.
Is this working? Thank you. Thanks, Anna. So it's a pleasure to be here and see lots of familiar faces, and don't think that's working again. Thank you. So yeah, pleasure to be here, and especially pleasure to be here with some amazing panelists. So yeah, a lot of my work over the years in local government has been in health promotion, population health, And I've spent quite a lot of time within that time focused on food, both within public settings, so sort of government-funded, owned or managed facilities and their retail outlets, but also within private settings and, as Anna said, particularly supermarkets, throughout quite a long journey with Adrian and the team from Deakin. So I'm happy to talk a little bit about both of those because I think that they're quite different, and some of the sort of levers for change are, really different, and the opportunities for change are different in those public versus private settings. So they asked us to have a think about some of the challenges that we'd faced. And for me, in both private and public, but especially private retail settings, the challenges have been certainly around engagement and getting retailers on board for creating the change that we as health promotion practitioners and researchers want to see in our communities. And I guess some of my, real learnings throughout my time in that work has been to start small with really short-term sort of trials and proof of concept type of things. You don't want to freak them out before they've really gotten on board. Learn to speak their language, because even though we might be, experts or whatever in our area, we're certainly not experts in their business. And definitely at the same time be speaking about the things that they care about, not just what we care about, even though the two certainly intersect at different points. Make things easy, and where possible, try and embed any of the changes that we're wanting to see into existing systems and structures that sit within the retail outlet or the business. Be flexible, build and leverage trust and relationships. I'd say that's probably perhaps the most important. And don't expect funding. Where possible, try and bring it. So those are probably some of my key learnings, and yeah, I'm happy to talk about some more stuff as we go. Thanks, Anna.
We're going to drop it at one point, I can tell. Thanks, Amy. That was great. And we will kind of go to all the panelists soon with some questions around what has worked in engaging retailers, because I know that's why a lot of you are here. Our final panelist, it's a real pleasure to introduce Professor Cliona Ni Mhurchu. She's a Professor of Population Nutrition at the University of Auckland, New Zealand, and an Honorary Professorial Fellow at the George Institute for Global Health in Australia. She directs a research program on population nutrition and scalable dietary interventions. She's Director of the Dietary Interventions Evidence and Translation, or DIET, research program, and Deputy Director of the Healthier Lives National Science Challenge. She's also a member of the Trans-Tasman Health Star Rating Advisory Committee and a Food Standards Australia New Zealand Fellow. So some interesting reflections from Cliona about that, I'm sure. I'd like to welcome you and give your insights. Thanks, Cliona.
Thanks, Anna. Well, reflecting about partnerships, I've suddenly realised I'm getting old, because my first foray into designing an intervention for my first foray into designing an intervention with a supermarket partner was actually back in 2004, so nearly 2 decades ago. We started a very small pilot study with one of our major supermarket retailers in New Zealand to test the feasibility of doing a large randomized controlled trial to look at a pricing intervention compared with a nutrition education intervention to see which intervention or what effect each intervention would have relative to a control. So that led to the SHOT trial, which was completed in 2009, and I think was probably one of the first large supermarket intervention trials where we also used sales data to evaluate the outcome of the intervention. And reflecting on that, I think certainly my understanding as an academic of partnership has evolved so much since that time, because we started that project very much as an academic one. We wanted to answer an academic question, and then went to find a supermarket partner who, luckily enough, we found one who was happy enough to engage with us. But I would say in hindsight, it wasn't a real true partnership. They were allowing us into their setting to do what we wanted to do, but it wasn't particularly anything they wanted to evaluate or do themselves. And over that time, I've been involved in a number of other partnership projects, and I'm pleased to say I have learned about co-design and co-creation. And we'll just mention briefly one which was not a retail intervention, but one with communities, with Māori and Pacific communities in New Zealand, where we co-designed an M-Health intervention with Māori and Pacific communities. And there was about almost 90 communities around New Zealand. It was a cluster randomized controlled trial, and we had about 1,450 participants within the trial. And that was an entirely different experience because it was co-designed from start to finish. We didn't know what the intervention was going to be when we started. We didn't know how to develop it, how to evaluate it, or how we would disseminate it. And then following on from that, we've since done another intervention with a supermarket retailer, the other major supermarket retailer in New Zealand, because we also have a duopoly there. And that one was also co-designed, where we actually we commissioned a facilitator to do some work, to do some workshops between public health academics and the retailers, to identify an intervention that they were interested in trialing and that we thought would potentially be good for public health. So I think it's been a real journey over time and thinking about the partnership. It's given me lots of material for reflection in terms of what works and what doesn't work. And I did ask us to give an example of challenges, and I'll just mention two. One is that compared to that first project that we did, and building on what Megan said about partnerships and communities and co-design, it's actually hard to get grant funding for true co-design because you don't know what you're going to be developing and how you're going to evaluate it. And that's just not how grant assessment committees work. They like to know what you're going to do and you know what your primary outcome is and what your hypothesis is. And we were just very lucky with our Ola Ora project, which was the one with the Māori and Pacifica communities, that we had a different kind of funder, a national science challenge, who was prepared to commission. I think it just goes off. Who was prepared to commission research and, I guess, trust the communities and the researchers to develop something. So that's just one thing I want to mention, that, you know, I think it often falls to us as academics to write the grants and to come up with the ideas, but that's not really co-creation or co-design. And then the other one is just that, as you might imagine, having worked with supermarkets and retailers over the years, is trying to balance commercial and public health priorities and potential conflicts of interest. I think that was probably some of the most challenging issues I've encountered in my whole academic career, were particularly in that first partnership where I was very naive and new and probably didn't have a lot of other peers that I could call on. Yeah, I think those are really quite tricky. You know, we want to work in partnership, but we have very different priorities sometimes. And, you know, I guess retaining your integrity as a public health researcher can sometimes be challenging.
Thanks so much. I'm going to try the on again, off again thing, see how it goes. That was fantastic. And I hope it gives the audiences here in the room and online a good sense of the breadth of our panel and their depth in partnership experience. So when you're thinking about your questions, you can frame them from the different perspectives we've got of the panel here, which is fantastic. We do have about half an hour for questions and further discussion. So please do think about your questions and definitely put them in the chat. I'm going to start with a couple, and it may be the panelists also have their own questions after listening to everybody else. I guess one of my questions is really thinking about, you know, the reason we're all in this is to have an impact, is to drive healthier food retail, to have better health outcomes in the community. So I was wondering if you might like to reflect a little bit on how important you think partnerships are to actually achieving the sustained impact that we're trying to achieve, and particularly if you've got any examples of where you think it's the fact that there was a partnership involved that actually led to sustained impact or impact at all. Does anyone want to start with that one?
I guess it's going back to that one that I mentioned about the community. Going back to our Ola Ora project, which was with Māori and Pacifica communities. And as I said, we're very proud of that because it really was true co-design from start to finish. And the communities got to tell us what was important for them, what they wanted to do. They had input into designing the app and the website. They had input into the trial design. We changed lots of things based, from our original plans. And they were involved in the dissemination and deciding what the key messages were. Now, when we actually did the randomized control trial, we found that the app and the website had no significant effect in terms of the outcomes that we were measuring. So, on one level, as academics, you might say it didn't work or it was a failure. But what I would say was that it was an incredible success in terms of building trusting relationships with those communities. And similarly to what Megan was saying about the Indigenous communities here in Australia, our Māori and increasingly our Pacifica communities in New Zealand have a deep distrust of academics. They have been researched on to the nth degree. They are fed up of being researched on and then never hearing again from the researchers and never seeing what they get out of it. And so it was a whole new experience to be in a 4-year project where they were so closely involved, but at the end of it, we're so happy with the outcome and uniformly positive and wanted to work with us again. And we still have such strong relationships with both the community leaders and the communities, and they say, oh, we must work with you again. We've spent time building the relationships. It would be great to do more work together. And also just in terms of an RCT, which is, kind of an interesting design for, we have what's called Mātauranga Māori, which is like a Indigenous knowledge. And that is not their way of evaluating things. But we did do an RCT, albeit with modifications. But we had incredible recruitment rates, incredible follow-up rates. Like, as I said, like we got more people taking part in the trial than we even needed. And, we only lost less than 10%. And that's incredible for any RCT, but almost unheard of for these particular communities. I'll just finish there. There's got to be a timer.
I might just add to that. And I've, like I think I said in the beginning, I've had the immense privilege to be a part of actually a long research program that I'm contributing just a small piece to. But what I've seen over that time is just like Cliona, has done in terms of that co-design. There was a point in time where we actually learnt from the shop study and conducted the Shop at Rick study in remote communities. And what was really important about that, and that I've really learnt and valued, is that feedback of preliminary results to communities and to stakeholders to get, to say, well, this is what we think we're seeing. Is that in line with what you're thinking? Are we missing anything? And what needs to happen next? And what came from that was very much this is what needs to happen next. There was this trusting relationship that had been built. And so there was a much more directive around, what the next steps were. And so that piece of work has been conducted. And what I've seen so much more from that relationship development is so much more drive around the question, much more control around the implementation. So very much a co-delivered piece of work rather than the Shop at Rick study, which was a little bit more, I would say that we were doing with partners, but more so the Healthy Stores 2020 study that was much more driven by partners. And then the fantastic thing that comes out of that, when that's successful, is it's not only us disseminating that work, those research partners think then it's their responsibility. So they They make sure that that becomes a part of their work. So for them, their organisational policy, but they also see it as their responsibility to share that story with other communities for benefit. And so that's the fantastic thing, is you have this amplification of effort when there's that level of ownership. And that's a wonderful thing of that relationship development.
Yeah, I'm perhaps bringing in a more negative note because I wanted to pick up on engagement with retailers and the challenges of that, and particularly the challenges in low and middle income countries. In the countries we're working with, there's really very, very little incentive for any retailers to want to change anything. How close do I need to be? Gosh, it's like kissing this thing. Very little incentive. So why is that? First of all, the healthy eating trend is nowhere near as strong as it is in high income countries. People enjoy having condensed milk rather than coconut milk in their food. And there is sugar as part of on the table for you to put on your food, sprinkle on. So it's a very different attitude. So there's not that push. Secondly, there is very little legislation in place. So there isn't the threat of legislation coming at all. These companies are very, very close to government, much closer, and there's no transparency in many of the government workings. So they can go and talk to government. They have the ear of government all the time, and they can do what they want. And finally, in many countries, the companies are owned by families. In Thailand, for example, it's all family owned. So there are no investors. There's no outside body who may be able to put pressure on. So that's the kind of context we're working with. So how do you actually persuade retailers to want to engage at all? What would be their incentive? What we've tried to do in the project is to build a business case. And using the global examples as to looking forward, legislation will come. There will be a healthier food trend. So you need to get things in place now. But how well that will really work, time will tell.
Thanks, Fiona. Amy, did you want to add to that? Because I know a lot of the work we've been doing with retailers is similar to that, building on the business case and trying to identify the value proposition for the retailer.
Yeah, I mean, it's at a very different scale to the international work that you've been doing. But I think about some of the biggest successes that we had with the Eat Well at IGA project was, I guess, the scaling up from the pilot phase to the full RCT phase by, I guess, really strongly engaging with one chain in that early phase. And really, it actually was a project that was kind of initiated by the supermarket as opposed to the research community or even local government. Local government was kind of the liaison or the middleman. But once we sort of had some proof of concept, demonstrated that it worked, demonstrated that some of these things could work, demonstrated that we were trustworthy partners, it really generated a sense of ownership in some of the key players that were our partners in that retail environment. And they were the ones that actually convinced other chains to get on board. And, I don't think that that us as government partners or research partners would have had anywhere near the level of persuasiveness that a retailer had to another retailer. And so having that one single champion was such a critical element in scaling up from one chain of stores to a whole suite of a whole range of chains. They already had a really connected relationship. The new chain owners understood that the existing chain owner would understand their perspective and their world and their environment and had similar motivations to them. So to me, that was one of the critical elements in being able to get those other new stores on board or new chains on board. We were very lucky in that sense.
Thanks very much. Now, I'd love to open up to the floor and the Zoom chat. So if you've got any questions, do raise your hand and somebody will get you a mic that may or may not work. And do we have anything on the Zoom? Not yet. Anyone got a question they wanted to ask from the panel? Well, while you're... Oh, sorry, I missed that.
Thanks for that. Any thoughts on what these collaborations might look like now that we've got to deal with the milk runs and the Ubers, etc., who are doing it online instead of in traditional ways?
Very good question. So you're talking about, do you think we need partnerships with the Ubers and the, yeah,
they're going to be responsible for huge quantities of food products being sold around the place.
Does anyone have something they want to contribute to that?
Yeah, that is, and that's not a new problem for countries like China during, it's online, getting food online is the norm. And obviously during COVID, we saw this huge increase on, online grocery and just fast foods. I think you can get a Kit Kat probably delivered to you in Bangkok by somebody on a motorbike. So it has changed. I think it's going to be quite difficult because a lot of these companies want something back. So for UNICEF, for example, they want to, we were talking about this earlier, they want something to say, UNICEF approved. And we're not able to do that. So a lot of the conversations that we've tried to have, they're different companies actually in East Asia, but they stop because the companies are not getting anything back. And I think that's something we really need to tackle. What are we as researchers or implementers giving back to these companies, because they don't do anything for free, and what is acceptable to give back? And I don't think we've really got anywhere near that yet.
Yeah, actually, it leads to a question that I wanted to ask, independent of the kind of Ubers, but I agree. I think that some of the learnings that you've each had would speak to my question, which is really around those indicators of value to the retailer. So I think a number of us have thought, as I said, about the business case. How do you help level the playing field? How might they be like a first kind of mover in the space? And I'm just wondering if you have any reflections on the topic of the panel, which is really around these partnerships that are being developed. So the academic, the government and the retailer. Do you think that the partnerships themselves can help give the retailers value or even de-risk perhaps some of the potential risk that they might see in trialling an intervention? And I wondered if you had any examples of where we might use these partnerships to do exactly what you're saying, de-risk a bit of the change.
It's hard to say. I mean, when I think about supermarket retailers, they definitely see some benefit in working with public health, particularly if it's individuals who are well known in public health, and also the reputation of the university, they see that as a real benefit. But the more I work with retailers and the work that Gary and I are doing with food companies at the moment, their bottom line is sales. I mean, really, yes, there's maybe some advantage in being a first mover, and there might be some advantages to them in deferring regulation, which seems to be a kind of major motivator for a lot of them. But they're very explicit about the fact that if whatever you trial, if it drops their sales, they're not going to do it because they have that primary responsibility to their shareholders. So it is about finding those win-wins, something that is good for public health, but also, is not going to impact too adversely on their profit line, despite the fact that in New Zealand, our supermarket retailers, our Commerce Commission has just found that they make like $130 million a day in excess profit. But they're not prepared, obviously, to drop that. So, yeah, I mean, I think they do see advantages, but I would say they're quite selfish, in terms of their motivation. They're not there for the public good. Those private retailers, I should say, and obviously it's different with publicly funded ones.
Does anyone else want to comment on that?
I think for retailers working in the remote Aboriginal and Torres Strait Islander context, things are so stark. You know, most of those stores, not all of them, but most of them are owned by Aboriginal and Torres Strait Islander remote community residents, and they know what the food supply is doing to their health. So they have a demand for that, and that's been one of the opportunities that we've been able to work with. But at the same time, there's no way they have the $130 million profit margin. So, you know, it's a fine line, and we do have to be really careful of those business outcomes. So the win-wins are the best way forward. I think one of the things that I think would be nice to celebrate, though, is that I think collectively a lot of us here in the room have done a lot of work around you know, so we all come to this research with nutrition as the motivator, but have done a lot around customer satisfaction and what customers mean to businesses, and really kind of trying to understand that and keep that on the agenda, and understanding business outcomes and sort of co-designing that. And I think a lot of that has come through that trusted relationship that comes over time, where businesses are then ready to say, okay, we're ready to share this next piece of data because we have this relationship and we can trust you, to then, you know, determine, well, what impact this has on our gross profit. So yeah, I think a bit of a celebration of what has been achieved, but certainly a lot more probably needs to be done in terms of what are those motivators for business and how we can interact with those.
Yeah, I was going to speak to the win-win stuff and kind of link that back to, you know, really understanding what the business drivers are and, you know, where those pinch points are for them, because that opens up lots of opportunities. And I think that the value, or one value of the partnership, is, I guess, the information that the research world brings to the retailers, and the credibility that research and public health can provide to retailers in some of their work. So an example is in the Eat Well at IGA trials, we really utilised the health star ratings. And for those retailers, so we put like shelf tags on products that were 4.5 and 5 star rated in the grocery department. And for the retailers, they were really excited, putting aside some of the logistical challenges for them in the stores, but the concept of that was really exciting for them because it provided them another way to promote items without having to put them on special. So for them, it was about profit. For us, it was a really clever way of promoting the healthiest food in the store. And so that was, you know, that was a win-win. I think same with things like fruit and vegetables. You know, if they're gonna have them there in the first place, then they need to sell them. Otherwise, they're throwing them away. So if researchers come in with ways to help them sell the healthy food that we want them to sell, then that's a profitable venture for them. So, you know, I think that you know, research, public health shouldn't underestimate what they can bring to retailers in both public and private settings. There's certainly a lot that we can offer.
Yeah, that was a really good example. Thank you, Amy. Now I'm going to open up again. I think, is there one question up there? And then there's one over here.
Thanks, Anna and panel. Leaning into successful retail education programs over the last couple of years, you look at Greenpeace and they've got a consumer booklet of traffic lights of what produce you should purchase due to either its impact on the environment or its fair food with slavery and all those sorts of things. Where is the opportunity for us in social licence in Australia that we can traffic light our supermarket companies for their social licence impact in overall wellbeing, whether or not their association with alcohol, tobacco, gambling, oil, so that when you actually buy a vegetable from one supermarket, it's actually got a green indicator because that supermarket chain may not have the associations with oil and gambling that our duopoly has to reduce the prices of the fresh produce in those stores. So can we lean into social licence so that people can make better overall wellbeing choices for mental, physical, environmental health? Is there an opportunity there for this RE-FRESH group and what you're doing to sort of lean into that and maybe hit Middle Australia with their decisions?
I think that's a great question, and I will see if anyone on the panel wants to speak to it. But I don't know, is Gary here? No, I know Gary Sachs is doing a lot in that investing space and leveraging it. And I don't know whether Simone or Adrian might want to speak to it, but does anyone on the panel want to speak to that? So I think you're spot on. Simone or Adrian, did you want to speak to what Gary's doing or not so much?
Happy to have a brief comment. That is such a good question. And I'm sure there's someone here who was telling us yesterday she's doing her PhD on something really similar to that. So maybe she can have a comment in just a moment. But at the George Institute, each year we produce the State of the Food Supply reports, and we pick a topic each year to assess the different retailers on. So it's been nutritional profiles, it's how much added sugars in their product. We're looking at the greenhouse gas emissions of their products. And I think that's a fantastic idea for a future explicit comparison between the lead players as to what their performance is across those, and then publicising that so that we're naming and shaming, but boosting up the other ones who are doing a good job.
I was also going to mention ATNI, who have recently done, that's Access to Nutrition Index, yeah, and they recently did a looking at supermarkets in Britain and measuring them again on a whole lot of different aspects of healthy food. So there are examples where that's been done.
And I guess, I mean, I think it is a great idea. And I guess also bringing sort of the sort of topic around partnerships to that question as well. I mean, I think one of the things we've been doing through the Nourish Network is exploring with local councils the potential interest in sort of an accreditation scheme, if you like, for more shopping strip cafe type retail. And I think there's quite a lot of interest in that. So I think there's levels of rating and scorecarding, and some can be supportive, some can be more punitive, if you like. So I think it's worth exploring all those different avenues, and we should collectively look at those projects. I think there was a question over there.
Catherine Beckola, Deakin University. Thanks for the panel. It's a good, really great panel. My comment and then a question. My comment is that when we're talking about, these large transnational corporations, I think that sometimes we shouldn't be looking for the win-wins. And, there was a leaked document from Nestle recently that showed no matter what they do, they'll never have healthy foods that will be their top sellers. So that's my comment. My question probably goes across all types of retail environments, and that is, what do you do, or how do you celebrate the wins from these partners so a win might be something to do with labelling or whatever they're doing, when another part of the organisation is, increasing their budgets to market to children, for example? How do you balance those wins and losses?
Thanks, Catherine. Who would like to start?
I can only say I don't actually know the answer, but would just point out that it's not dissimilar to what happens across governments as well, where you have one department or ministry who are doing really well in one area, but actually it's being undermined in others. And I'm not sure. I mean, again, there may be people in the room who can talk better to that than I can, because I think, we need to be looking at it, from that perspective, the public good perspective as well as the corporate perspective. Is there anybody out there who knows more about this?
Does anyone else on the panel want to contribute?
I think my only comment is that those wins do need to be celebrated to then be able to have engagement around those other topics. And now I'm probably coming from a very different situation and there might be good reasons for those other things that are not working so well. But yeah, so that celebration helps with the discussion of getting onto what else needs to be happening.
The only thing I would add is I think both your comment and your question speak to the need to be really clear on the scope and the potential risks of any partnership. So not everything can be a win-win. So I think it is about identifying what might be a win-win that can be worked out within that partnership, and what are the risks of developing that partnership, because you don't ever want to lose your trusted kind of role, either as an academic or a public health professional. So I think it's a really important question. I don't think there are clear answers, but I think it's one of the things that I think I've learned a lot from working in partnerships is having to always reevaluate what's the scope of this partnership, where does it look like it might have risk, and so you can either celebrate the wins and try and build on what you haven't won yet, or you can say this partnership is too risky. And so I'm not sure, Fiona or Amy, not to put you on the spot at all, but I just think in your context, there are a lot of those trade-offs. I don't know if you've got any reflections on how you've learnt to make those trade-offs, or how you've observed people make those trade-offs in a quite a trusted way.
Yeah, I think that I guess just in experiences that I've had, there's been a real difference between working in places where you have the leverage and places where you don't. I guess if you want to work in, or in my experience, if we've wanted to work in partnership with a retailer, we've had to kind of be in a situation where there's a win-win. And that doesn't necessarily mean we're getting everything that we want. I guess in the public setting where you've got more levers for control, so you're the funder as government, or there's stricter regulation that you can lean on to drive the change, then there's more opportunities to have where you don't have to work in that win-win environment. I think that kind of direct engagement with retailers like supermarkets, for instance, can't be all that it is. Because, as you say, some of the big things that you want to change, they don't want to change. And so perhaps that's not the approach to change those things. But I guess, I like to be able to create the change in the things that we are all willing to do, and then perhaps look for other opportunities to create the broader change that perhaps one party isn't willing to do, and that may be through advocacy or legislation, or a completely different approach that may not involve that partner in partnership with you.
Did you want to add anything, Fiona? And then I think we have one question online.
Yeah, not really to that question, so I'm going to talk about something else. I was actually going to ask also the other panelists who they see are the new partners who we ought to be working with to actually move things forward. Because I know for UNICEF, one group that we have not got involved yet with the retail work is kids and adolescents themselves. Now, I know we don't really I don't like listening to adolescents because they tend to say things you don't like, but actually they are the ones who are going to be eating food in the future when we're all gone. And they have got some wacky ideas, but they also have some pretty good ideas sometimes. And that's the kind of group that we need to be now nurturing and bringing forward. And if Bite Back, who are a group of young people in Britain, they're doing absolutely amazing work, getting much more highlight, much more attention to healthy food, and really speaking up, and they're unafraid. And I think we need to be looking for these different groups. We tend to just all talk to each other and we all agree how dreadful it is, and then we go and tell all the retailers how dreadful they are, and we've got to find some other way. So I'd be interested to know from the other panelists what other kinds of groups you think there are who we could be partnering with to be able to move on some of these things that we've got so stuck on.
Thanks, Fiona. So I'll ask the panelists to offer a response to that if they have one, and then Sian's going to read an online question.
I'm really conscious of the co-benefits that come with healthy food. And it, to me, screams of opportunities to work with others who have different agendas, but who also benefit from when people eat healthy food. So, the mental health advocates and the climate change sector, there's a whole range of different areas where we, by working together on something related to healthy food, we're advancing somebody else's agenda. And I think that there's great opportunities there. I too agree that community-driven work is really powerful too, because, and also especially young people. So those would probably be mine. Thanks.
I think in the remote retail context, because as I described earlier, that the owners of a lot of the stores, not all of them, are community members themselves. We do have a lot of that input already, which is fantastic. But I think we do continue with them to think, well, how can we have greater engagement with customers as well, because they are their priority. But certainly for us in this sector, we are really at the stage of and we have been all the time engaging policymakers, but I think we feel like the time is ripe now, and retailers are asking for that themselves. They want to see a level playing field, and so they want some policy action around that. And so that's like, I recognise that's quite a different space, but they're kind of our next really natural partner, I think, in this space.
Oh, just one final, I guess, medium or platform, I think, is around social media and social media influencers. And I think we do really suffer in public health in that a lot of the social media influencers aren't people who, you know, are necessarily reflecting the messages that we want to get out there. But there are a few, and if you think about somebody like Jamie Oliver and what he managed to achieve, I think it just shows what's really possible if you can find the right voice who can work in partnership and be really credible as well. So, you know, I can't say who that is in Australia or even in New Zealand, to be honest, but I think it's where so many people get their messages from as well. It's not just about what's available in store, but it's about what people want to buy and what they think they should be buying too.
Thank you. Sian.
So we've got a question from Cindy Jones from the Prevention Centre. She'd like to know the pros and cons for healthy retail environments from the growing awareness of food insecurity.
Thanks very much, Cindy. Who would like to start responding to that one? So the idea of, I guess, a bit like your co-benefits point, Amy.
Yeah, that's a really important question, because in so many countries, huge price rises, and that has meant that government policy, it's really not a very good time to be saying, oh, well, let's just restrict the amount of cheap, rubbish food to poor people. You know, that's not a good message. Plus, you know, I was in Mongolia recently, where there's very little food production anyway. There's a lot of imports. And the government is desperately trying to encourage local production, but a lot of that food is not very good food. Is this really the right time to be bringing in marketing law? Probably not. So I think we have to be sensible to the context and the reality that there really is huge suffering out there. And, you know, to be saying, look, give your child nothing at all or give them some noodles, I think I would say the noodles, and I think most people will. So we have to accept that is there. On the other hand, it was very interesting during COVID that in some of the very remote communities in the Philippines, where there are no fresh food markets, but there are sari-sari stores. So the sari-sari store owners are buying up food to then resell in their little store, and that's where people are buying from. But because people couldn't get to the main town to get any fresh vegetables, they started stocking them in their shops and suddenly found a demand. So some good things can come out of food insecurity as well, more local buying and you know, selling of foods.
I talked briefly about this earlier this morning around food insecurity and how it is, you know, we really do have to be considering that these days. I mean, in relation to the person online, their question and how retailers engage with that, I think, I mean, it can be either for good or it can be to the detriment of the consumer as well. So retailers are doing some really good things in terms of repurposing foods that are perhaps slightly past their best and making sure that they're getting out into the communities and so on. But at the same time, during COVID, for example, in New Zealand during the lockdowns, we did an analysis of sales data that showed that the prices went up, you know, during COVID. And that was particularly had an impact on our lower income families in New Zealand as well. And the retailer said it was because they didn't have time, to keep restocking the shelves. Everybody kept emptying them. But I think we have to be very mindful of the fact that the retailers do play a really critical role, and I think we have to have food security and food affordability front and forward at the foremost of our mind when we're engaging with the retailers now as well. And I think we will find that they're probably quite maybe even more open in that respect than they are in relation to obesity and unhealthy diets more generally.
Thank you. So I can't believe we've come to the end of our time. That went super fast. So it was a very engaging discussion. I'd like to thank our 4 panellists very much for their different perspectives and insights. It was really rich discussion, and also to the audience online in the room for your questions. I guess a couple of things that have really struck me. I think that question of, new partners, who else do we need to be working with to drive this movement? And also that question of scope, how do we make sure that we're partnering when it's the best time to partner and when we add value and when we understand the partners' perspectives? They really stood out to me, and I think they're actually great takeaways for me and hopefully for you as well. And then I think in terms of the more kind of granular conversations we're having, I guess what I would love to say is that, through Refresh and through Nourish, we now have these huge networks that are extending internationally of people who are really passionate about making healthy food retail work and about applying partnerships when that's applicable. So if you do have questions about how might I get this started, how might I work better in this context, what is an example of how it's been done before, I hope I can speak for the panellists and for the network more broadly. Do reach out and we'll put you in touch with the right people, because I think it really is by sharing our learnings that we can drive healthier food retail at scale, nationally and globally. So just a couple of quick housekeeping. You will be sent a short survey just to assess your feedback on the panel discussion today. And we have been recording this webinar, so we will check with the panellists, and we hope to put this up on the Refresh and the Nourish Network websites. So if you could join me now in thanking our panel, I would like to close the session. Thank you very much.